Alrighty, we are live once again with Toronto's Associate Medical Officer of Health, Dr. Vinita Dubey joins us again this week. Thank you so much, Doctor, for joining us.
Hi, good afternoon.
Good afternoon. So my name is Dilshad Burman. I am a web writer with CityNews and 680 News, and I will be moderating this chat today. This week, we have a flood of questions once again for the doctor, this time mostly around school reopening because parents are so very concerned. So let's get started right away.
All right.
Alrighty. So we'll start with a few of these are all kind of similar. We've got Asha, MS, concerned mom, Margaret. Everybody has very similar questions. So I'm going to put them all together. Most parents are concerned about the lack of ventilation and not enough space for their children in schools to socially distance, as well as different teachers coming in and out of class all day. How are they going to mitigate all of these risks for children in school within 3 weeks?
So those are all really good questions. There are 4 main school boards in the city, and there are also many non-publicly funded, private or independent schools as well. So my first step would be to find out from the school that you plan to send your children to, what are their plans? If it's the publicly funded school boards, they have had to review their plans with the Ministry of Education and have had to have their plans approved. And so you'll see with the 2 English school boards in Toronto that in high schools, they've required that they be smaller classes, 15 students. With the elementary students, they have not changed the class size, and that's certainly something that we think is important. We think it's important to have physical distance in those elementary school grades. And so we'll have to wait to see on that point. There are, though, a lot of other measures that the school boards have put in place that are very good ones. The idea behind a cohort is to keep your child with a set of students, and they don't mix and mingle with other people in the school. Right. And so if they're exposed to someone who has COVID, that it's just that group that you have to be concerned with that could go in isolation. The idea of teachers coming in and out of a classroom, that can actually be done in a safer way. Teachers can probably maintain that physical distance easier and wear protective equipment that will prevent the spread as well. So there's a lot of other layers of protection for grades 4 and up. They'll wear a mask for JK to grade 3. We strongly recommend that those children wear a mask, the enhanced cleaning and disinfection. The one thing that we've talked about here is that screening. Before you send your kid to school, make sure that they don't have symptoms. And if every parent ensures that, and we keep track of that for staff as well, that again is a very important public health measure that was not in place before COVID. So there are a number of measures that the public school boards have put in place. We've also put out guidelines just this week on our website for schools that are not publicly funded to make sure that they follow these precautions as well.
Okay, so then speaking of the cohorts, Margaret asks, Toronto Public Health has stated that a bubble of 10 is the ideal situation for reducing the virus. But then in the classroom, the teacher has his bubble of 10 plus 24 students plus 20 staff for a minimum of 54 people in their bubble. Does that make sense? It's only 3 weeks to school, and she's really worried that each teacher is going to have a bubble that is this big.
So the actual bubble, the social bubble, is you plus 9 other people who you can have close contact with. And usually it's your household members and maybe other family members or friends. That is your social circle, we call it, or social bubble. For the classroom, we call it a cohort. I mean, it's the same idea, but it's those students who are in your classroom who we recognize in a classroom will not be able to keep that physical distance at all times, but will not be mixing and mingling with other cohorts. And so the teacher, though, with other teachers is required to maintain that physical distance between other teachers so that that does not become a cohort. The teachers themselves, and we see this actually in all workplaces, that, you know, you can be very, if you work in retail, follow your public health precautions with your customers, making sure that you keep that distance, and then you go back in the lunchroom and then you have lunch with someone, one of your colleagues. And that's what we do not want. And so we do not want teachers to have a social circle with other teachers, to make an extra social circle, not at all.
Okay, so at this point, then it would be the teacher, their 10 people within their home, and then the kids. And that would
and then their cohort. That's right. Yeah.
Right. So that would be, so the teachers, each teacher would have somewhat of an extended circle because it includes the students that they're going to interact with every day.
It would have their cohort, the school cohort. Now, that being said, the teacher will be able to wear personal protective equipment. So in your social circle, when you interact with your family members, you don't need to wear a mask because we've decided for those 10 people, you can be close to them. But in all other encounters, you wear protection. And so a teacher will be required and should definitely be wearing their mask. We've heard that teachers will be provided medical masks, which will provide extra protection for their students and for themselves. And so that cohort that they have, while they will have closer contact, they will be wearing personal protective equipment. Just like, I always give the analogy, just like when I go to the emergency department, I wear my protective equipment. And so that doesn't become a bubble for me because I'm protected.
Right. So it's not the same as your family bubble. It's still more protected. It's still more distance. There's still more layers between you and the cohorts.
That's a good way to say it. There's layers of protection between you and the cohort. That's right.
Okay. This one, Faith, sounds a little bit frustrated, and she says, how can our children go back to school without proper safety measures being in place as outlined by the TPH? Because all schools, like you said, might not necessarily follow. So her question is, does TPH have the authority then to enforce these things?
I do want to say that both of the measures that have been put in place, and like all of the measures that are being put in place, are excellent measures. And we do actually support the public school boards and their plans because they're very good plans. We do have recommendations for consideration on specifically the cohort size. And the reason for that is we think that maintaining that physical distance as much as possible is important. I mean, we've told everyone, we've told you and all of our viewers, keep your distance, wear a mask, wash your hands, and stay home if you're sick. And we feel that message should continue in the classroom. So if you can't keep that distance in the classroom, wear a mask, for example. And that might mean for some of the younger children, if that's one layer of protection. So I do want to say that the plans that have been put in place are very good plans. It's up to the Ministry of Education to approve them, which they have, and it's up to the Ministry of Education to work with the school boards on actually implementing the plans. We have definitely been there, though, to provide guidance.
Okay. Hussein asks, do you believe that kids in grade 4 can wear the mask during school for 5 hours, and is that healthy for them to be wearing it for that long?
So we actually recommend that kids have mask-free breaks. Yes, I don't think that wearing a mask for 5 hours is something that we should expect. It's going to be very tough to do that. And so taking mask-free breaks where you take your mask off while you're outside for recess, maybe you're having one of your subjects outside as a classroom, those are measures that we have actually recommended because we recognize that it will be very difficult for kids to wear a mask continuously and to wear it properly for that long.
Right. So on that note, then actually, Carol asks, mask etiquette dictates that reusable masks should be stored in a paper bag between uses and not in your pocket. So when kids go back to school, they will be allowed to remove their masks during recess only. Can you suggest a safe and efficient way for them to store their masks while they're out in the schoolyard?
So a good question. Again, we have to hammer out these logistics. And what we recommend is that you send your child with a bag that's labeled clean, and that might have 1 or 2 extra clean masks in there, and a bag that's labeled dirty. And so when they take their mask off, you could also have a transition bag, like a bag that they put the mask in between uses. It's not clean, it's not dirty, but they're taking it off. There are also, in the emergency department where I work, we put a paper towel down, put the mask, it has to be face down. But I think putting it in a paper bag might be the safest thing for children. So that and that it's labeled such, so that they know which mask to use, and it's clear what's a clean mask and what's a dirty mask. And for children that can't read, it could be pictures that you use, for example.
Pictures or colors, red means no, green means yes, simple things like that for sure. I think there's so much retraining that's going to happen, not just for the kids, but even for us as adults, to just keep all of these things in mind on a daily basis. There's definitely a whole, and as kids go back to school, there's definitely a whole retraining of methods to stay clean. Like we've always been told as kids, wash your hands and wash your hair and wash behind your ears and all of those kind of things. And now we're going to have to teach all our kids how to take care of their masks properly. It's just going to be one more layer of training.
It's one more thing, exactly. But I think what we've seen is that in other parts around the world, kids do wear masks to school and have been able to manage.
Absolutely, absolutely. It's just, I think what most parents' concerns are definitely regarding how their kids are going to adjust, I think. And I think we don't give kids enough credit. I feel like kids are very resilient. I have two nieces working through COVID, learning online, and kids are very resilient. Things tend to stick faster, and if the rules are enforced, they'll follow them.
Yeah, and I think the other important piece here is that if a child cannot tolerate a mask, they feel they can't breathe with it, they're getting very anxious with it, maybe they have sensory neural issues and they cannot handle a mask, there are exemptions. And so I think that that's an important piece as well. It's not something that will be stuck to a child's face, no ifs, ands, or buts. And so I think I agree that it's a learning curve, and we're all going to have to figure out how to wear a mask and breathe, carry on with our activities, learn at the same time.
Right. And then one more thing to reiterate, I think, is that parents are not mandated to send their children back to school. There is the option of online learning, and you can take advantage of that.
That's right. And, we all want our kids to be able to socialize, but there's a lot of things, a lot of criteria that are going to go into us deciding what is going to be right. And it may be a different answer for each of the kids in our households as well. And that may be one deciding point. Yes. Absolutely.
Okay. Let's move on. We've got a few non-school questions now. We'll move on to some other questions. Lee asks, is it possible to get a cold or flu in isolation? I have stayed home and away from everybody, but I feel like I have a cold and flu, and I'm really run down.
So, yeah, absolutely. The symptoms of a cold or a flu of feeling weak, maybe having congestion in your sinuses. I mean, you can get those without having an infectious disease for sure. You could get a sinusitis, which could be a result of reacting to the pollen or the flowers that are in our that are blooming right now. Actually, they're quite beautiful, but they actually cause a lot of symptoms to people. So it doesn't always mean that it's from something that's contagious, that it's from a virus or a bacteria. It could be for other reasons. Yes.
Okay. This is interesting. Sandbar asks, has anyone come down with COVID twice with months between positive tests?
Not that I'm aware of, and we're keeping a close eye on it. I think what we are aware is that if you've had COVID, we were saying, within 90 days, you could still test positive, but it doesn't mean that it's a new infection. It's just that the test is actually picking up a virus that you're still shedding, which I think is important to note that, when you've had it, you may actually shed this virus for a long time. And I think we'll have to see down the road, does that have any impact on the individual or on transmission? We actually don't think that it's capable of spreading the virus that way, but we are keeping a close eye on people who may have had it and then get sick again and are tested to see whether there may be any evidence for what we call a reinfection, for getting infected again.
Right, absolutely. And then in terms of, you said shedding for 90 days, a reinfection, would that then, because a lot of people have asked things like, does that mean the virus has reactivated in you, or did you catch it again? Where are we standing on that?
Yeah, those are all good questions, and I don't think that we know. And even within 90 days, it doesn't mean that you're shedding the virus every day. You could have negative tests, and then we test you again, and then it's positive. We've certainly seen that. People who are getting tested because they want to go visit their family in a long-term care home, or they want to go away and they want to get tested to be sure, and they're coming back positive. And we find that actually they're not infectious right now, but it might be because they had COVID, say, 60 days ago.
Okay. Vladdy asks, after stage 3, is there a stage 4? What stage is back to normal?
There is stage 4, yes, or, the province's plan talks about, right now we're in phase 2. We did stage 1, 2, and 3, and after that it goes to phase 3, I believe, where stage 4 is. I may have some of the nomenclature wrong, but there is more to it than this. You'll see amusement parks are closed, water parks are closed right now. There are still restrictions on a lot of the things that we do. Convention centers, a lot of them need special exemptions in order to be able to open, conferences, travel. So there is more to come for reopening. Based on how we do with COVID, and also based on what we see people have done around the world. We've seen around the world people have gone to the equivalent of a stage 4, opened everything up, and then have had to backtrack. And so it's a learning process to decide how much further we go and how fast.
Okay. So a couple of travel questions coming up. Margaret says, I'm returning to Toronto from France and want to know if I can get tested for COVID-19 in Toronto. And if the test is negative, do I still have to self-quarantine for 2 weeks?
Yes, you can certainly get tested. Anyone is eligible to get tested. If you're quarantining and need to seek medical care, that's fine. You can go. You just have to wear your protection. But even if the test is negative, you are required by the Federal Quarantine Act to stay indoors, to self-isolate for 14 days from your return.
Okay. We've talked about this before, population-wide testing, but I'll ask it again. Why are we not testing everybody? We don't have a very large population in Canada.
Well, we have 30 million or so people. I mean, even in Ontario, there are a lot of people. I can tell you in Ontario, in a week, we're doing between 20 and 30,000 tests over the week, which is quite a lot of tests. And so there is surveillance testing that's going on. That means testing more of the population just kind of routinely to get a sense for what the virus is doing. I think if we want to test every single person, we have to realize that you can't do that all in one day. And when you get your results, when you get your negative result, what does that mean? What if you have symptoms 3 days from now? Well, you'll have to get tested again. And so I think prioritizing the testing to those who have symptoms, those who have been in close contact with someone who had COVID, are really good strategies for right now.
Right, absolutely. Wings asks, in the COVID alert app, what does provided key count mean? If you are provided a key, does it mean that you are positive?
That's a good question. I'm not sure what that means. I can certainly look that up, and we can talk about it again next week.
For sure. Okay, let's move on to some things that we can and can't do. Nino asks, is it safe to visit the dentist at this time with regards to the dental tools used and being so close to the dentist when you're talking to them?
So my first suggestion is that you call the dentist to find out what precautions they have in place. Dentists do have stringent protocols and requirements for seeing their patients. The actual tools themselves, even before COVID, had a really good system of making sure that they were cleaned, disinfected appropriately. And then in terms of that close contact, because that's the bigger risk for COVID, there should be personal protective equipment that the dentist and their staff wear so that even if they might not have symptoms but might be contagious, they can't infect you. And so I would ask your dentist what their plans are. Okay.
Marie asks, is it okay to go for pedicures and manicures? Is that safe now?
Well, I think the question is it safer? There's nothing that's going to be 100% safe. And I think that's part of recognizing as we're opening that everything carries a risk. Mm-hmm. And so, for some people, going for a pedicure, manicure, even though it is safer, is too high a risk and they're not going to do it. And especially if you have maybe a chronic health condition, that may be a choice that you make. That may be a very good choice for you. When you go for these services, you want to make sure that they're following the public health protocols. Mm-hmm. The protocols that we have in place are very evidence-based. They're good public health measures so that you can prevent the spread in these places. And so you want to make sure that they're being followed. If you find that you've gone to a place and they're not screening you before to see if you have symptoms, they're not wearing masks, I mean, please do call us. You can call 311 so that we can follow up with these places, because with the public health measures, things can be done in a safer way.
Absolutely. We've talked about this one as well, but again, good to reiterate. Sam asks, when will the second wave come and how bad will it be?
Hopefully it won't come. I mean, not every country so far has had a very large second wave. And so we're planning for it. Unfortunately, we can't predict it. You know, we can predict that in the fall, we will see our regular respiratory viruses. Whether COVID-19, the virus causing that, will be part of that, we'll have to wait and see. But what we're also hopeful, though, is that with all of these measures, we'll actually also be able to curb some of those regular viruses. So maybe flu season won't be as bad because we're all keeping our distance, washing our hands, and wearing a mask, for example. So that's why we keep a really close eye on the numbers. That's why we're not dropping our guard for the precautions, because we recognize that a second wave could be around the corner.
Right, okay. So we've got a few mask questions, and this one actually came in last week as well. Sharon firstly says that she loves our Q&A sessions every week.
Oh, thanks, Sharon.
And she says, I was wondering if the mingle mask is recognized by the Ministry of Health. I have 4 grandchildren returning to school soon. So the mingle mask, I had to Google this myself. It is a clear plastic mask that goes across your entire face like this. And a lot of people have been asking about whether or not it is approved.
Okay, so what I would say is the mask, the studies have not shown that a mask like that is effective. So what they have shown is that a cloth mask or a non-medical disposable mask is effective. Actually, the more layers in the cloth mask, the better. So I think I mentioned last time, if you had a cloth mask made up of 12 layers, it would give you the same protection as a medical mask, which is quite fascinating. Yeah. So those plastic masks, they haven't necessarily been studied. And as well, you have to think about how you're going to clean them. I think that's a really important point. Because if there are nooks and crannies in there, if your germs can get stuck in there, well, then it can actually be hazardous. You're wearing that mask every day, you're cleaning it, you think you're cleaning it well, and it might not be effective. So I would not recommend that mask. That kind of a mask or a face shield might be considered an alternative for someone who has difficulty hearing, who may need to read lips, and so that you could provide some protection. But those masks are not equivalent to the cloth mask or non-medical mask.
Okay, good to know. Yeah, they're very popular. When I Googled them, they were also being marketed as good masks for dating, because then people can see your face through the plastic. But if they're not safe, they're really not good masks. So,
yeah, and they may turn out to be safe in the future. We just don't have evidence for it right now.
Right, absolutely. We've got one person who calls themselves Fed Up Taxpayer. They say, I work in part of the building where management said that employees do not need to wear masks because they don't come in contact with the public. Now, the new Toronto mandatory mask bylaw indicates that indoor public spaces, you have to wear masks in indoor public spaces. But is there any intention to extend that into private businesses as well? Because clearly not all, employers are mandating masks within their buildings.
Right. What I would say is, in a workplace setting, the rules that fall into place there are through the Ministry of Labor, so workplace safety guidelines. If you're working in a workplace, you have good ventilation, and you're able to keep 6 feet distance for the whole time when you're working, well, then you might not need to wear a mask in those settings. And also, so I think it would be up to each workplace to figure out what the guidelines are from the Ministry of Labor to require masks for their staff. That being said, even if a mask is not required, if you want to wear a mask, I'm sure you would be allowed to wear a mask. And I think it's something that you could talk to your employer about, to say, well, have they looked into the guidance? Should a mask be required? But if you cannot maintain 6 feet distance in that workplace setting, then that's something that needs to be looked into.
Absolutely. We actually have an interesting one coming in right now from Sabi. Sabi asks, can coronavirus spread through the sweat of an infected person? Should I consider that at the gym when I'm handling equipment?
So, I mean, right now, it's hard to say whether it's actually in the sweat droplets, but I think that's why it's really important that we make sure we wash our hands and that we disinfect the surfaces. And so that's why when you're changing equipment, using different equipment at the gym, it's really important that they be cleaned and sanitized in case there may be some contamination. Right now, the way we think that coronavirus mostly spreads is through those respiratory droplets.
Okay.
I haven't seen anything to suggest that it can be spread through sweat, but our precautions, regardless of cleaning and disinfecting and washing our hands, should help prevent, even if it should.
Okay. More travel questions coming our way now. Jacques asks, planning a trip by bus to Montreal next month. How safe is it to travel by bus for 5 hours if I'm sitting by myself and nobody is next to me?
So a bus is an enclosed space. I'm not sure that all buses have windows open to allow for better ventilation, though they may have air conditioning, which may help. Wear a mask on the bus, I would say that for sure. But can you maintain that 6 feet distance when you're on the bus? If you can space where a few rows around you, no one is, well, then I think that's pretty safe. I mean, people are traveling by plane and by bus. I guess you could ask the bus company, are they screening passengers to make sure they don't have symptoms before they get on the bus? We know that that's something that's happening at airports now. So these are the kinds of questions you could ask to decide whether it's safer for you.
Okay. Couple more here. When can we expect the Ontario Manitoba border to open? I would like to get to my sisters in Winnipeg before the snow falls. Would that be possible? Candy asks.
So I'm not aware that Manitoba has restrictions from people coming from Ontario. I know that eastern provinces did. It could be that Manitoba or the Prairie provinces do have that. So I think the best thing to do is to find out from you could go to the website to find out what their requirements are.
Right, absolutely. Yes, because I remember you mentioning that there isn't even the quarantine protocol between provinces. You don't necessarily need to quarantine for 14 days if you go to another province even.
Ontario doesn't have that rule. Now, other provinces, if you come from Ontario to their provinces, they may have those rules. So I know the eastern provinces did have something like that. So you'll have to find out everywhere you're going what the rules are there.
Absolutely. Okay. This is kind of interesting. So 300,000 Canadians are snowbirds. They're retired and they often live in Florida or Arizona for the winter months. So are they going to be stuck here this winter, or will they be provided a window to cross the border?
So that's a really good question. And I don't know what the answer is. I think if you have a residence, you're allowed to travel across the border, but I'm not an expert in that. The other thing that I tried to look up was previously was if you go to the U.S., do they have a quarantine for you? And right now, I can't find any evidence for that. I think what I can say, though, is if you go, you have a residence there. When you come back, there's restrictions on you. And that's another point to consider as well.
Yes. Plus, the border is still closed for non-essential travel. That's a federal thing. So I think that's going to be the main thing, is whether they open the border at all for even a small window to let people go for non-essential travel, right?
That's right. And whether this would qualify as essential travel. Yeah.
Exactly. Okay, we have one question coming in right now from Shelley, which I guess a lot of people are wondering, if schools can open safely, why can't offices?
Offices can open safely. There's no restriction on offices from opening, but I think it's very clear that for offices to open safely, they probably need to be at a reduced capacity. And I've talked about those pinch points, the common areas, waiting for the elevator. What about the bathrooms? What about the lunchroom? I mean, and so maybe at your desks maybe 6 feet apart, but it's all of those other considerations. The other thing is, how are employees going to get to work? If they rely on transit, well, will that cause overcrowding in the transit system? Is that a risk that could be prevented. So definitely there's no restrictions on offices from opening. Early in the pandemic, not all offices could open. And so it's up to each office to, again, have their protocols and plans in place for having safe return to work.
Absolutely. This is one that we've addressed before, but let's talk about it again. Tina asks, what have been the common sources of community spread? Wouldn't this information be collected already by contact tracers?
Yes. So I think when there's still about a quarter of our cases who we call community spread, and we can't quite pinpoint where they got the infection. And that's because we know most people get it from someone who they've had close contact with. And if you're not aware of that, well, then it's hard to say, was it the gym? Was it the grocery store? Was it, other areas? And that's what we call community spread. So we can't quite pinpoint what the reason is for community spread. What we can say, though, is that our cases have declined a lot. And so even though there may be a portion that have community spread, the absolute numbers are quite low. But I think we still have to every day consider that wherever we go, we could catch the virus in the community and to take the precautions.
Okay. And so then a related question then, Mira asks, if the number of new infections in Toronto is so low, does that mean that the new infections that are still occurring can be traced back to the existing ones, or are they still coming from unknown sources?
Most of them can be traced. So most of them we can figure out, well, what's the likely reason why you got the infection? Absolutely.
Okay. Let's see. J.I. asks, what is the overall strategy for handling this virus? It seems like we began seeking to flatten the curve, and now we've shifted focus to keeping the case numbers low. We cannot sustain this type of activity long term due to the effects on the environment, on the economy. So should we not try to completely stamp out the virus with a hard lockdown, or learn to deal with it and use some type of treatment, but not necessarily a vaccine?
Yeah, so that's a good question. I mean, we've done a good job of flattening the curve, and essentially what we're trying to do is to keep the curve flattened. And so you can see in Toronto, our numbers are, we're down to single-digit numbers actually every day, which is remarkable, which is really fantastic, and is a testament that people are continuing to follow their measures. And I think the idea that you can have a firm lockdown until you get down to 0 cases and keep 0 cases for a long time, that doesn't always work. We've seen countries that have done that and still look at what's happening in Australia, for example. Like, they had very, very little cases, and now they're back in lockdown. The case counts have increased. So I think part of what we have to do is to learn to live with the virus, and by that meaning open things up. We've opened things up slowly. Let's keep up with our measures. Let's keep the case counts low so that we don't see that resurgence. That's what we're trying to do. We're trying to keep the curve flat, continue to keep it flat.
Right. Okay, let's move on to something different. Samuel asks, is it safe to meet people, up to 25 people in a social gathering? What if everybody can't maintain 6 feet distance?
Then it's not safe. If you cannot maintain 6 feet distance, then it is not a safe social gathering. And your bubble is only 10. So even though the numbers are, you can have a social gathering of 50 indoors. If you cannot maintain that 6 feet distance, do not have that gathering. Only have as many people as you can accommodate in the space.
Right. And then I think we've talked about this numerous times. If you can't maintain the distance, then you have to wear masks and you have to follow all of those protocols as well.
It's true, but if you're having a gathering, again, it's a social gathering, so it's not a necessity. Relying on masks and keeping people together, saying, okay, well, we're going to have 50 people in this small space, but everyone has to wear masks, that still is not safe. We know masks provide protection, but that 6 feet distance is also really essential. And so for social gatherings, that's why a recommendation for restaurants, for banquet halls, all of these places is that you have to be able to accommodate who you can maintain a physical distance for.
Okay, makes sense. Okay, Daniela asks, many seniors in retirement homes are being restricted from leaving the facility for medical appointments, and if they do, then they have to quarantine for 14 days when they get back. What are the potential health impacts of this level of self-isolation on them, physical, emotional, and mental?
As far as I know, retirement homes should not be restricting people from going to medical appointments, that's for sure. And they also should not be putting people in self-isolation for that long. So I think what I would do is I would talk to the retirement home on what their policies are. Those certainly are not the provincial guidelines. And so I think that we have to be careful about asking people to go in self-isolation when it's not required, because we recognize that that's a considerable thing to do and it has other negative consequences.
Absolutely, yeah. This is an interesting mask question, because I think, I guess lots of people are not wearing their masks properly. So C asks, can you explain how to wear a mask properly? Because they see too many people wearing it around their chin, under their nose. Could you once and for all tell us how to wear a mask properly?
So wash your hands, get your clean mask, put it on by the ear loops, tie it at the back. It should cover your nose, your mouth. It should not be gaping, and keep it on. Then don't touch your face. If you inadvertently touch the mask, make sure you sanitize or wash your hands afterwards.
Okay. Those are all good things to know, because I think, like, you put your shoes on, then you put your mask on, but your hands are dirty because you touch your shoes. So that's something that I've been struggling with as well. So we have in my home sanitizer at different points in the house, so that wherever you go, you can sanitize your hands. If you touch your shoes, you sanitize your hands, then you put your mask on. It's a new normal in the house too.
That's right.
Okay, let's see.
I think we've hit time now, have we?
Oh my gosh, we have gone over time. It is 1:06. Thank you for reminding me, Doctor. I think we've had so many questions this week, and I just kept going. All right, my apologies, Doctor, for keeping you longer. Thank you so much for joining us.
My pleasure, and stay safe, everyone. Bye-bye.
Okay. And we'll see you next week. Okay.
Okay, bye-bye.